Hello, Mrs. Jones. How are you today?
Good.
Good, wonderful. My name is Leslie. I'll be your CNA, and we're going to be washing your hands and giving you a nice nail file and all
Sounds
that.
good.
All right, well, let me go ahead and set up over here.
Okay.
How was your day today?
Wonderful.
Great. It is pretty today. And so you have a good view. We're going to do that hand. So I already know I'm going to have this over here. Let me provide you with some privacy back here. She's got that call light within her reach. Everything again is in the room. Let me open here. Yep, I have my basin, my soap and lotion, and I've got my emery board and my orange stick. So now I'm going to gel my hands and put my gloves on so I can get everything I need. This one here. One-time use, so I'll go ahead and probably put this right now over here. And get this out. Put these things right here. I'll be right back. I'm going to go ahead and fill this with some warm water.
Okay.
There you go. There we go. Nice warm water there. Again, fill it, a third. Just slow filling here. Goodness gracious. I think that's good. And go ahead and turn it off. Here. Would you like to feel the water before
Sure.
I soak your hand in there?
Oh, excellent.
Good. All right. Go ahead and set your hand in here. If I need to lower this so she's not in an awkward position or move it, it's as best as it can get. If their skin is very delicate, I will go ahead and put a towel underneath here like a washcloth so they're not directly on that. So there we go with that. It's nicely soaking there. Washing and rinsing. These two I will need here. And this I will probably put over here. Actually, I can, no, I'll just keep it here. All right. Oh, is it good? I just felt nice and warm. Let me get my soap here. And we talked about just putting all over on both sides, all over with all of our washings. Great. It's nice and soaking in there. I'm going to go ahead and support. And here we go. Making sure I get fingers between. Similar to foot care, guys. I'm done with this here. Have it actually soak in here, get it all in there. Circulation starts going. The same thing in between there. Sometimes they go days, guys, literally without having their hands washed really good. Okay, so I'm gonna prepare this. All right, make it drip a little and come right here. Just a little there. That feel good?
Yes.
Good. Go ahead and grab this here. Between every finger, making sure it's not wet. I'm observing, I'm looking, are there any warts, sores, nails, how do they look? Nice and clean. So I'm gonna start by doing this right now. I can come underneath or on top, but you wanna make sure that that bevel is up come in here, very little here, not to hurt. If your patients have shorter nails, please do not dig in there. But our residents usually have the long nails. Again, if I'm actually taking stuff out, use this to clean. Taking stuff out, use this to clean. So all that is nice and clean. Clean that a little. Now I'm gonna file. One direction, guys. I wanna make sure I'm holding at the knuckles. A lot of them have arthritis. Don't just be filing and they're ow, it hurts. Hold it really good. Go to one side. Hold it really good. If I see that it needs to be clipped, we don't do that. Even the nurses will kind of go, ooh, they might need the doctor to come and do something, especially if they are on blood thinners or they're diabetic. You want to be very careful. Everything is good here. Again, this is a one-time use. We throw it. I'm going to make sure I clean everything off. And now the part they really enjoy. Warm it up here. And really good here. Again, this is good to go between the fingers here. It's not like your toes, okay? I bring that good circulation. You'll see life coming to their hands. Any excess lotion, we go ahead and dry. You can even use these. And dry, flip around. Everything looks good. All right, Mrs. Jones, I'm gonna go ahead. Have you rest your hand up here. Support here. We are all done here. Let me go ahead and get rid of all this.
All right.
Here. A little bit high here. Yeah. Actually, I didn't need to do that. I'm gonna go ahead and rinse this. I just throw it in the toilet, but that's kind of full, so I'm just gonna throw it here. Again, it's not any terry stuff. Nice and rinsed. I'm gonna dry the inside really good. Away from me. I think I need to dry here as well. Just here. Here we go. Look at my two little friends. The soap and the lotion. Put them in here. Close this up. Here, I'm not taking my gloves off yet. Go ahead, excuse me here, thank you so much. Get this, put it in my wet linens here. I'm scanning everything. It's now good for me to take my gloves off. I'm gonna gel, because that's what we do every time we take our gloves off. All right, Mrs. Jones, does that feel really good?
Sure. Yep.
Again, we're only doing one. In real world, we do both. Your call light is within your reach right here. And let me make sure this bed is lowered. It probably still is lowered because I never raised it. It is. It is locked. See, the breaks down. Would you like the privacy curtain open or closed?
You can leave it. It's fine.
We'll leave it like that. All right, Mrs. Jones, if you need anything, my name is Leslie. Please give me a call on the call light there.
All right.
And we're done.
All right. Thanks.